Thank you, Prof. Thank you. Okay, can you hear me? Yeah? I will. I was just waiting for you to say that. We don't have the pointer here. Last time I left it here. I don't know, somebody mistook it, and I thought I didn't bring my own pointer, so I will have to just go around and say things like that. Okay, so after the first lecture, or should I say the last lecture, many people came to me and talked about the positive feedback and the negative feedback. I understand it's a difficult concept to understand. Okay, so I will just have a review of it, and then we'll get on with the subject. It's a little bit of hassle. I have to stand here and move slides. But today's subject is fluid balance in nursing care. Okay, so as we talked about homeostasis last time, homeostasis is to maintain a stable internal environment in a human being. Okay, a stable, please, I will. So a stable internal environment in your patients, okay, in human beings around or in healthy people. So a stable internal environment I remember when I was in my intermediate, we had a physics professor, a professor of physics, who was telling us about the forces that keep balance, and how you walk, how you push the earth and you move. And he was like, so suppose a man is walking, and he walked out of the class, and he didn't come for 10 minutes. And we were sitting there like, what happened? There was a joke. Okay, so a stable internal environment to keep a man or a person or a patient living. Okay, so that is homeostasis. And in order to do that, we need to understand, for example, different sugar, blood pH, fluid. Fluid is very important. Okay, fluid is very important, and we ensure that the patients are sufficiently hydrated. Not even patients, but healthy people also. That's why we have public health department. Public health department is to inform people when they're healthy. Okay, not to get sick. When the weather is hot, they should drink more. They should stay indoor. They should take care of the kidneys and stuff like that. So intake of fluids as well as the ability to pump fluids to kidneys and away from tissues. Nurses can determine a patient's dehydration severely if they have low blood pressure, for example, or pinching skin like this. Okay. Pinching the skin, and the time it takes to go back to normal tells you how dehydrated a patient is. When you will be working in a hospital, you will be very, very good at judging a person's hydration level, inshallah. That depends on how good we are teaching, but anyways, we are trying our best. So going to connect this today's topic with the last time's topic, we had some examples of homeostasis. Okay. Thermoregulation, how we maintain a temperature, like we maintain a temperature of this room. Okay, we have a thermostat, temperature goes up, the signal goes to the effector, air conditioning is turned on, temperature goes down, negative feedback, the signal stops. Okay, so that is negative feedback. Other examples are blood glucose, for example, and other stuff. So I took this slide from last lecture just to highlight, just to explain it one more time for the people who could not come to ask an explanation again. So blood glucose is maintained in a fixed range, okay, 90 milligram per deciliter to 110 milligram per deciliter for healthy people. Now, how do we maintain that temperature? That blood glucose level is that when we have normal blood glucose here, Okay, now something happened and the blood glucose level goes up. Okay, for example, you eat food, and high blood glucose means you eat something, goes into intestine, absorbed into blood. Okay, now the blood levels of glucose go up. That sends a signal to beta cells of pancreas to release insulin. Okay, release insulin. Insulin takes the sugar from blood inside cells. Okay, from blood inside cells, and taking it inside cells lowers the blood glucose. Now when blood glucose is taken to the cells or to the liver, the blood glucose level declines, goes back to that range, that specific range that we say 90 to 110. Okay, so when it goes there, this is a stimulus for going back and stopping the insulin from release. Okay, it's going and giving a negative effect on insulin level. Okay, so this is negative feedback. That's how we maintain things in one specific limit. Similarly, if the stimulus is declining blood glucose level, it's going down, the alpha cells of pancreas are stimulated to release another hormone which is called glucagon. Okay, glucagon goes to liver, and the sugar that we previously stored in liver as glycogen, it breaks down glycogen and makes new glucose. Okay, glycogen breaks down glucose. Glucose comes back into bloodstream, so blood glucose level rise to the set point between 90 to 110 milligram, and that coming back to normal sends a signal back to glucagon to stop releasing, negative feedback. Okay, so that is the most of the time negative feedback. That's how negative feedback helps us maintain the homeostasis or a stable internal environment in the body. Okay. Now what we do actually, we receive a patient who has some kind of problem with their homeostasis. Either their temperature is not good, their blood glucose is not good, or other examples that we have here. For example, their osmoregulation is not working, they are dehydrated, gases exchange is not good, the oxygen is not enough, or carbon dioxide is more, or pH, blood pressure, hormone levels, or metabolism, some threat to their living being, some dysregulation in homeostasis. Okay, that's what we call dysregulation in homeostasis. Okay, so that is when a patient presents in the hospital. Okay, if they haven't been able to maintain it, for example, they are not well hydrated. Why? When someone is thirsty, they would go and drink water or coffee or juice or. Assalamu alaikum.
ملاحظاتنا امس على الشيء مال حضور الدكتورين وقصة التكييف. في بعض الطلاب ربما على اساس انه يجي قبل الوقت. It's okay. You can hear me? Okay. ربما بعض الطلاب يجون قبل الوقت. احنا نقول 8 و25. الناس جايين قبل الوقت 8:23 يعتبر غياب، لان صمت صدق بدري بس يعتبر غياب، فهو الوقت اهم من جدا. خلينا لان ربما الطلبه ما يحسون من ساعه لانه يبي يستشكل ساعه، فخليناها من 8:20 يعني اي حصه 10 دقائق قبل الوقت و5 دقائق بعد الوقت. اوكي مفهوم؟ يعني عندكم 10 دقائق قبل الوقت و5 دقائق بعد الوقت فقط. واللي امس في غياب لاحظناه، اللي عنده اي غياب بسبب عذر يجيب لنا القبول التسجيل. ما ابي اعدد الاسماء لانه كثير من الطلبه غايبين حصتين امس في نيرسينج عدل، فاللي عنده غياب يجيب لنا التسجيل. نعم.
لا خمس قالوا لنا بس نطلع يسجل حضور.
لا هو غلطان، مفترض في البدايه، فخبرنا احنا الدكتوره حوازن ان في البدايه صححنا لكم احنا الموضوع، بس هو الحضور من البدايه، حضور الاناتومي لاب من البدايه. اوكي؟
هو قال لنا يتخصصون بس
نعم يبقى
امس قالوا لنا ان يتخصصون
غلطان المفروض انه من البدايه البصمه صححنا لكم كلكم يومكم سعيد وموفقين ان شاء الله.
Okay, so getting back, we were saying if someone is thirsty, they are dehydrated, they will go and drink water, okay? That's normal, they will rehydrate themselves. But if someone has got either a very bad infection, gastroenteritis, diarrhea, vomiting, something like that, they cannot replace that amount of fluid, they will be clinically dehydrated. Okay, that's when people come to hospital, and that's what when we are there to help them, you are there to help them. So in order to understand the whole scenario of how things work and how the fluid regulation is carried out, we should first know what is the normal physiology. Okay, what is physiology? What's the physiological basis of fluid and its regulation? So as you know that there's a difference between the muscular component in men's and women, or males and female. So because of that, there's a little bit of difference between total body weight in males and females, and that's how fluid is total body fluid is divided. Okay, it's 60% fluids and 40% solids in men, and 55% and 45% in women. And out of those fluids, there is further distribution. As I said, something which is in blood and something, for example, sugar, it is either in serum or inside the cells. Okay, insulin takes it from the blood into the cells. You understand that? So there's a difference between something which is inside the cell and outside the cell. Okay, inside the blood, for example, bloodstream is outside the cell. Okay, it's not inside the tissues. Okay, it's outside. So the fluids here, 60% or 55%, we divided further into intracellular fluid and extracellular fluid. Okay, so intracellular fluid means fluid inside the cells, and extracellular fluid means fluid outside the cell. Okay, so extracellular fluid is further divided into two types: interstitial fluid and plasma. Interstitial fluid is what I was telling you. It's roughly not exactly equivalent, but let's get the concept that we talked about last time about lymphatic system. Okay, so we have a circulatory system, blood circulation system, and we have lymphatics. Okay, so the fluid that goes, the blood, for example, that goes in arteries and comes back in veins or venous capillaries, etc., that is one thing. But there is some kind of fluid which is left inside the tissues, okay, that goes inside the tissue, and it's left inside the tissue, inside the cell, interstitium, between the places, okay, interstitium, between the places. So that fluid is called extracellular fluid, and it is called further interstitial fluid. 20% is the plasma, which is inside, which is in the blood already. Blood is, since I told you, extracellular. Now inside the blood there's fluid inside red blood cells and outside. That is, outside is plasma and inside is red blood cells. So these are three compartments, and that's how fluid is divided. Now when we are working to understand this, we have, we have to understand really this dynamics in depth, because the extracellular fluid and intercellular fluid, they are a very important concept to understand. Okay, now 2/3 of the body is the intracellular and 1/3 is extracellular. Now extracellular is made up of a bunch of things. Okay, so it is present in its interstitial fluid, lymph, peritoneal fluid inside your tummy, auditory fluid inside your ears, synovial fluid in joints, pericardial around your heart, pleural around lungs, GI fluids, ocular fluid, glomerular filtrate, cerebrospinal fluid, CSF, which is inside the brain. So all kinds of fluids, they are they make up the, that part of the extracellular fluid. So intracellular fluid and, yeah, sorry.
Doctor, can you just talk slowly? Slowly.
Okay, that's why I'm repeating things, okay? I'm important things I'm repeating, so I'll try to be slow. Thank you for pointing out. So intracellular fluid and then extracellular fluid. Extracellular fluid is bunch of places where its names are different. It can be inside brain, it can be inside joints, inside the heart, peritoneum. It's all extracellular fluid, okay? And then its amount. Now intracellular fluid is roughly 40% of body weight, and it is 25 liters. And interstitial fluid is 12 liters, plasma volume is 3 liter, and extracellular fluid together, this 12 and 3 makes 15 liters, okay? Yeah, so intracellular, which is 40% of your body weight, is 25 liters. Intracellular, like inside your cells of the brain, cells of the blood, muscles, for example, or intestine, smooth muscles, all the cells inside, that's majority, okay? That's huge, that's 25 liters, okay? And then the interstitial fluid is part of the extracellular fluid, which is 12 liters, and plasma, which is your blood content, okay? Your blood, the plasma part is 3 liters. That's why at one time you can donate a very little amount of blood, okay? You cannot give 1 liter of blood to another person, okay? You understand? You donate blood, any one of you ever donate blood? Blood donation? You ever give blood to another person, a patient? Yeah? Yeah.
When someone is dehydrated,
Yeah.
they say that it causes of fluid retention. How is that possible?
Fluid retention in one part and not the other part. For example, when someone has got edema, okay, swelling of feet, okay, or swelling of tummy due to a disease, so it means there's more fluid in extracellular compartment and less fluid in intracellular. So cells are dehydrated. You understand? So that's why we're talking about these places, these spaces, okay? There's another thing called third space fluid. Yeah.
The extracellular fluid and the interstitial fluid are the same?
Yeah, they're the same. At some point their composition may be different, but mostly it's water, mostly. Now you have seen maybe a person with a kidney problem whose legs are swollen but they are dehydrated. That's because more extracellular fluid in the than intracellular fluid. Now what happens is you gain water and you lose water, okay? You drink, food, drink, metabolism, like gastric juice, pancreatic juice, things are secreted. That's how you gain water, and you lose water from insensible water loss, skin, lungs, okay? Through when the dry air comes in and it goes back, it also takes water. You urinate, things like that. So total intake should be equal to total output, or gain or loss should be equal. So you drink water, and if you lose too much of water, for example, diarrhea or vomiting or an accident or bleeding or something like that, your blood pressure will go down because blood volume will become less, okay? And if you take too much fluid, for example, an intravenous or injection of large amount of fluid, then blood pressure goes up. Like you have a patient dehydrated, low blood pressure, you give him intravenous normal saline, blood pressure goes up, okay? So that's how we do it. So water actually is movement from one place to another is determined by electrolytes. For example, you know about osmosis. Osmosis, you know about it, right? Osmosis is that you have a big box with a permeable membrane between it, okay? On one side, fluid is hypotonic, on other side fluid is hypertonic. Okay, so the fluid moves because of the concentration of that electrolytes, hypertonicity. The normal physiological concentration is 0.9% sodium chloride. So when electrolytes are not an imbalance, they control the osmolarity of the fluid, and they help to maintain hydration, they help to maintain the acid-base balance we'll talk about. They carry the electrical current, the nerve impulse. Okay, once you think something, you want to use this remote, your brain connects with your muscles, and you think and you click the button. How does that information goes from your brain to your muscles? Through electrical impulses in your nerves. Okay, those electrical impulses happen because of electrolytes, and the most important ones are sodium, chloride, potassium, bicarbonate, calcium, phosphate, and magnesium. You just need to know names. Okay, there's no compulsion to memorize, and you'll get to know that. And so ECF and ICF, the extracellular fluid and intracellular fluid, is maintained in balance because of the electrolytes. Okay, that's why when you are vomiting, you're losing electrolytes from your stomach. Okay, electrolytes. That's why if you lose too much of fluid, too much of potassium, you vomit too much, and your heart will affect. You can go into a cardiac arrhythmia. Okay, your heart is pumping because of that electrical impulse that is under the effect of potassium. Okay, if you have loss of potassium, okay, if you lose too much potassium, you can have arrhythmia of your heart. Okay, so electrolytes are very important. Now, how do we do that? How do we maintain electrolytes? It's by the urinary system. When you drink lots of fluid, it goes to kidneys filter it out, and depending upon the concentration of your plasma, they either lose sodium or retain sodium. Okay, there are some hormones that needs a lot more details. But here, first of all, what we are going to talk about today is the pH, the acidity, the concentration of H ions. Okay, H ions. H ions are the acidic content of the body, and as I said, for sugar, there is a narrow limit from 90 milligram per deciliter or per 100 ml to 110. Similarly, there is a narrow limit for pH. Okay, 7.35 to 7.45. Okay, that is the physiological pH in which body can function properly. Okay, if pH goes down, it means more acid that will injure or harm the cells, and the homeostasis will be compromised. Okay, if pH is more, that means less acid, more bases in the body, so it will also harm the normal functioning of the body. Now, acids are produced as byproducts of cellular metabolism. Okay, when you eat something and it is broken down, different types of acids are produced. For example, phosphoric acid, lactic acid, fatty acids, and carbonic acid. Acid substances are eaten in food. The food, sometimes they are acidic, their pH is variable. Okay, so for example, you're eating something which is acidic and it goes to your bloodstream, it changes the pH from 7.35 to 7.25. Okay, what you eat is acidic. Okay, it has got more H ions, so it brings your pH of your blood from 7.35 to 7.25. Now, in order to maintain homeostasis, your body has some functions, some mechanism like thermoregulation or sugar control or other stuff. It will bring it back to 7.35. Okay, in order to maintain homeostasis, we have to maintain the pH between 7.35 to 7.45. It's a very narrow range, but it's very significant. You understand this, right? So these are the acids, and then there are some bases like ammonia. Ammonia is a basic substance. Basic is the opposite of acid. Okay. So what we do for maintaining that pH, we have some systems. They are called buffer systems, and then we have lungs and kidneys that help us maintain that narrow range of pH. Okay, like we maintain a fluid balance, we maintain temperature, we maintain blood glucose, we also have to maintain the pH. Okay, and for this we have systems which are called buffer systems in lungs and kidneys. How do they work? For example, now buffer systems are body's first line of defense against extreme changes in H ion concentration. Okay, so buffer system is something that works in a way that, okay, pH goes up, it will bring it back. pH goes down, it will bring it back. Okay, it's like insulin and glucagon. Insulin, if sugar is high, insulin will bring it down. If sugar is low, glucagon will bring it back. Okay, so a buffer system is something like a combination of acid and base, and whatever changes in the pH occur, it will bring it back, and it will maintain the homeostasis. Okay, maintain the pH range. Now, for example, one of the systems is bicarbonate carbonic acid. Okay, so there's a very explanatory equation here that water plus carbon dioxide makes carbonic acid. Carbonic acid dissociates into ions, and this arrow means the equation can go in either direction. Okay, so now for example, you have more concentration of H ions in the body. Something that you eat was acidic. Okay, something that you eat last time, the food was acidic, and there is more concentration of H ions which is decreasing the pH. Now those H ions will combine with HCO3 minus, and they will make H2CO3. H2CO3 will convert into carbon dioxide, which will be eliminated through breathing. Okay, when you breathe, you will eliminate that carbon dioxide. Okay, now if there is, for example, less concentration of H ions in the body, okay, your carbon dioxide that you produce and you throw it out by breathing, that will combine with water, make H2CO3, and that will dissociate into H ions, and the decrease in H ions will come back to normal. You understand this? We have to maintain, for example, 100 H ions in the body. Let's say, for example, 100 H ions in the body. So if there are 120 H ions in the body, so it will go back to make carbonic acid. Carbonic acid will make carbon dioxide. Carbon dioxide will go out with breathing. Okay, when we breathe, we give carbon dioxide out. Okay, we take oxygen in, right? You understand that, right? Okay, so if there is like 80 or 90 H ions, okay, now we need H ions. Now carbon dioxide is produced all over in the body, okay, and we all the time we're breathing it out. So carbon dioxide will come, will join with water, make carbonic acid, and give rise to more H ions to maintain that pH of the body. Okay, so that's how buffer system works. Now other systems are lungs and kidneys. Now lungs work in a way that if there is too much acid, you start breathing rapidly, and that carbon dioxide will go out, and the too much acid will be finished. Secondly, if there is too much acid and kidneys need to work, that is, they regulate acid-base balance by excreting acid or bases. Now kidneys are a very intelligent part of the system. If there is more acid, they will lose H ions. Okay, they will lose H ions in the urine. If there is more base, they will lose the HCO3 ions in the urine. So that's how they will regulate. The urinary and respiratory system work together to control and maintain pH within homeostatic parameters 7.35 to 7.45. Okay, so as I said, insulin and glucagon, they work together to maintain blood sugar. Okay, the buffer system and urinary and respiratory systems, they work together to control and maintain the pH within 7.35 and 7.45. Okay, and this dynamic, you're eating stuff all the time, you're drinking soda, you're drinking and eating things that they're more acidic sometimes. Okay, or you're eating meat and your stomach is producing acid, and that acid is being absorbed in the blood, and that acid makes it more acidic, and that's when kidneys and lungs and buffer systems, they start working and bring it back or keep it in a very strict limit of 7.35 to 7.45. Now, urinary system, as you all know, it works slower. Okay, respiratory system works almost immediately. Okay, respiratory system works more effectively in short term. Urinary system works more effectively in long term. Okay, and they compensate for each other. Now, when we look at, for example, there is a famous test for a patient who has got some problem with pH. It's called arterial blood gases. Okay, and it's called ABGs. You'll hear it a lot. Patients in ICU, you're getting their ABG done all the time, like every 8 hours or 6 hours, ABGs. When you look at the ABGs and you say, for example, it's simple. If H ions more, this patient got acidosis. Okay. If H ions are less, this patient got alkalosis. Okay, acidosis and alkalosis. But then it becomes complicated, like which system is working, lungs working properly, buffer system working properly, or kidneys working properly, or which system is not working properly. Okay, so that's a little becomes a little complicated. Looking at ABGs, it's not very simple, very complicated. But since we are, fortunately, we're not talking about any diseases, but we're talking about the normal things, so it's easy for us. So, lungs, kidneys, buffer system. 3 things that make the pH stay normal. Okay, so buffer system, if H ions are more, they will convert it into carbon dioxide. If H ions are less, they will convert carbon dioxide into H ions. Understand? Lungs, they will vent out the excessive carbon dioxide, okay, that buffer system was creating because of acidity, and kidneys will either secrete H ions or not secrete H ions. Okay, depends on what is the situation of the plasma. So there are sensors in the kidneys. Okay, receptors, the cells, the filtering cells, they know that okay, there's something wrong with the plasma H ion concentration. If there is something wrong with plasma H ions concentration, then it must be dealt with. Okay, it must be corrected. Okay, we need to correct it. So these 3 things will work together. Now a little bit of look at what happens actually when there's changes in acids and bases. As I said, it's not that simple. We start with simple, and because you are very intelligent people, so we step by step make it more and more explanatory for you to understand, and you will get it. So if there are changes in H ions, for example, what happens when there is abundance of H ions, like more H ions, or lack of H ions, less H ions. Okay, so acidosis and alkalosis. Acidosis means too much H ions causing the pH to drop, okay, coming down, or too little H ions causing the pH to rise. Okay, acidosis, alkalosis. Your patient is not well. You look at the patient, You think your patient is not well, the face is not well, you know, the temperature, the body, the breath, there are signs and symptoms the patient will tell you. So you think, okay, this patient is not well, I need to get the blood reports. For example, this patient has got something with, you know, acidosis. For example, you say acidosis. Well, what kind of acidosis? Okay, so it either has to be respiratory acidosis or metabolic acidosis. Okay, so respiratory is your breathing is not working properly, you're not able to take out all the carbon dioxide. Carbon dioxide is staying in the blood and it is leading to acidosis. Okay, that is respiratory acidosis. Metabolic acidosis is that you're having some kind of metabolism that is producing too much H ions that your body is not able to leave. Some abnormality. Okay, if it's normal, it will be compensated. You have buffers, you have kidneys, you have lungs, you have all the system to bring back the pH. But if it is abnormal, then it will not be possible for the person, and that's why they come to hospital. Okay, they come to hospital, and the first line of defense is the nursing staff. So other terms is, for example, acidemia. Acidemia means excessive acid or H ion concentration in the blood. Okay, alkalemia, excessive base in the blood. Non-respiratory acidosis or non-respiratory or metabolic, that means decrease in bicarbonate or increased production of H ions, okay, due to metabolism. Respiratory, decrease in alveolar ventilation, alveoli, you know, the small parts of lungs where gases exchange, alveoli. Okay, so if alveoli are not working properly, someone's lungs is collapsed or something happened, then it means that's respiratory acidosis. Non-respiratory alkalosis, that means metabolic gain in the HCO3 causing increase in pH. In respiratory alkalosis, increase alveolar, someone is breathing heavily, like out of anxiety, like this. Okay, they go into a panic attack. That happens usually in panic attack. People are breathing too rapidly, they lose all of the carbon dioxide and they go into respiratory alkalosis. Okay, respiratory alkalosis. So as doctors or as nurses or as first line of defense in receiving a patient, we need to understand a little bit of this thing. What is respiratory acidosis, what is respiratory alkalosis, what is metabolic acidosis, and what is metabolic alkalosis. Okay, so are you with me? You understand so far? You have any questions? Yeah?
So when we have a problem for breathing,
Yeah.
We will check respiration and kidney, right?
Yeah. Yeah. So we suspect, for example, when the patient is looking sick, we suspect there's something wrong. Okay. So we will check the, for example, arterial blood gases or blood report to see what is not working. Okay. And what's the reason? Yeah.
So can you please explain what is H plus ions in the body?
It's the acidic content. You know, the H ions, they are the acid. For example, one of the acid is HCl. You know, your stomach produces HCl, hydrochloric acid. So it means H ions plus chloride ions makes HCl. So H ion is the hydrogen ion which is acidic. The chloride ion is just chloride ion. Or H2SO4, sulfuric acid, or H2CO3, carbonic acid. The H and the hydrogen ion will always be acidic. Okay? There was someone else raising their hands here. No? Okay, so a little bit of respiratory acidosis. For example, elevation of carbon dioxide pressures in arterial blood. Okay, so you do arterial blood gases, ABGs, that's what I say. You check ABGs and you look at the pressure or relative pressure of carbon dioxide in the arterial blood that is increased and it's causing the pH to drop due to decreased movement out of carbon dioxide from lungs to air. Okay. Now, lungs are not working properly for some reason. We'll see what are the reasons. And they are not able to get rid of the carbon dioxide that their body is producing. Okay. So, carbon dioxide is increasing in the blood. Okay. Carbon dioxide increasing in the blood, and its levels are more, so it's leading to more acidity in the body. Okay. More acidity, which is coming from respiratory system malfunction. Okay, that's why we call it respiratory acidosis. Okay, why it happens? There are a bunch of things, there are muscles problems, airway obstruction, something stuck in trachea, you have spinal cord injury, edema, there is fluid in the lungs. You don't need to memorize all of this, but just have an idea that anything obstructing the lung function may lead to respiratory acidosis. Okay, something which is making the respiratory function not go well. What will happen now? Kidneys, okay, this acidosis is starting in respiration in your lungs, but now kidneys are sensing that there's more H ions or the pH is low. Okay, so the plasma or blood that is circulating, it's H ions are low, H ions are low and pH is low, so they increase secretion of H ions, okay, to get rid of the acidity. Okay, now if that happens, if they are able to do it, the person will be all right. If they are unable to do it, then they will come to hospital. For example, if someone has got an injury or airway obstruction, or their lung has collapsed, okay, or there is fluid in the lungs, they won't be able to compensate it. Kidneys won't be able to compensate it, so they will come to hospital. Now, this is called metabolic compensation. Okay, kidney is the metabolic side, so metabolic compensation of respiratory acidosis. Okay, so acidosis is basically from respiration, but kidneys are trying to compensate. Kidneys are trying to get rid of those H ions. Now, what will you do? You will increase exhalation of carbon dioxide, artificial respiration, suction and ventilation, or intravenous HCO3, the base. Okay, so that's what, as doctors and nurses, we're going to do. Metabolic acidosis. Metabolic acidosis is that either the H ions are producing more, or there is some loss in HCO3 ions. Okay, why it happens? It happens in diarrhea or renal failure. Okay, diarrhea or renal failure. Diarrhea, too much diarrhea, gastroenteritis problems. Okay, so the person will have a loss of base ion. The HCO3 is the ion that represents base, the opposite of acid. Okay, it is the opposite of acid. So when it is lost, accumulation of acid, for example, from diarrhea or accumulation of acid, so too much acid in the blood, and HCO3 ions are consumed by that acid. Okay, consumed by that acid, or kidneys failure to excrete H ions. So it will lead to hyperventilation. Now, problem is coming from kidneys, but lungs are trying to compensate. That happens in acidosis. Patient will be hyperventilating. Okay, if you see the patient, they are hyper. One of very common causes is the diabetic ketoacidosis. Okay, a person who is diabetic, they have their blood sugar going, for example, from 90 to 110. Instead, it's going like 500, 600. Okay, it's very, very high, and because it's very, very high, then it leads to production of ketones and then production of acids. Okay, so the patient goes into diabetic ketoacidosis. Now, when you look at the patient, it doesn't, you can't see the sugar, okay, but you can see the patient is hyperventilating, okay, they're breathing in a way which is not normal, okay, and when you are a trained nurse or a trained doctor, you know that this patient has got acidosis, okay, they are breathing in a way which is peculiar, which is very particular of diabetic acidosis. So you give them intravenous solution of sodium bicarbonate, and you try to fix the problem, and then you find out the cause. You immediately try to address the problem, then you find out the cause. If the kidney is failed, then you go for kidney treatment. If the lungs is the problem, then you go for lungs treatment. Okay. Then is the respiratory alkalosis. Okay, that is due to voluntary behavior. For example, your respiration is voluntary, but you are doing it too quickly, okay, you're in a panic attack, or you're anxious, or you're breathing so heavily that you're throwing all the carbon dioxide out and your blood becomes basic, okay, or oxygen deficiency at high altitude, for example, okay, when you go at high altitude, your oxygen is low, so the carbon dioxide, and then pulmonary dysfunction, stroke, anxiety, they can all lead to decreased concentration of carbon dioxide, which is primarily, since respiration is involved, so it's called respiratory alkalosis. Now, it will lead to compensation from kidneys. The kidneys stop excreting H ions and they reabsorb bicarbonate, creating a metabolic compensation for respiratory alkalosis. Okay? So now kidneys are helping the respiratory system. Treatment would be change the underlying behavior, bring the person down from high altitude, or rebreathe carbon dioxide. Now, if someone is in a panic attack, usually they breathe into a bag, a shopping bag. They rebreathe all the carbon dioxide that they are throwing out. Okay, so you put a bag on their face and they're like, they're breathing. They're throwing out carbon dioxide, but rebreathing that carbon dioxide to retain that. Okay, and lastly is the metabolic acidosis, which is the concentration of HCO3 increases. It may be due to vomiting, diuretics, or endocrine problems, overconsumption of antacids. You have stomach burn, you drink too much of, what is the name of that syrup, white syrup like antacid, okay, like milk, like to relieve that acidity in your stomach. If you take too much, then you can go into metabolic alkalosis because you can do it more. Or severe dehydration. So what will happen? Hypoventilation. Your breathing will go down, okay, to conserve carbon dioxide and lead to. So this is how it looks like. Acidosis, two types, respiratory and metabolic. In acidosis, H ions more, pH less. And if it is respiratory, then HCO3 will high. If it's metabolic, this will be low. Okay? So this is the table that you need to really look into it. And so similarly with the alkalosis. And last is this picture is the arterial blood gases. For example, your patient's blood result is pH is this, PCO2 normal this, PO2 normal this, HCO3 normal this, oxygen saturation normal is this. Okay? So these are normal arterial blood gases. Now, your patient has got 7.48. What is this? What situation? Acidosis or alkalosis? Alkalosis. Okay. Now, the bicarbonate ion is 30. Is it high or low? High. Its normal is 26, upper side. Okay. So it's high. So what does it look like? This is high, okay, it can be the primary cause, it can be the metabolism, but then carbon dioxide concentration is high? Yeah, it's on the upper side, okay, so high. So it disagrees with the observed pH, can't be the primary cause of condition, okay, it's only compensating, okay, carbon dioxide. So in this case, okay, metabolic alkalosis with respiratory compensation, okay. So primarily it's metabolism which is causing problem, and then respiration is just compensating it. Okay.